Hi, I'm Dr. Goh Kim Yen from Ampang Putri Specialist Hospital. I'm a general physician and I specialize in hematology as well. What is stem cell? Stem cell is the origin of our red blood cells, white blood cells, and the platelets. So normally in a normal person, these stem cells, they hide themselves in our marrow. Throughout our life, these stem cells continue to work to produce blood cells in our body. There are varying sources of stem cells in a human body. These stem cells from the marrow can be excited and stimulated into the blood. And these stem cells, when they are in the blood, can be harvested with a machine. So the other important source of stem cells is in the cord blood. The most established use of stem cells are actually in the treatment of blood-related cancers. So if one suffers of blood cancers, the first step is to take care of the leukemia with chemotherapy, and then the second step is to have a stem cell transplantation. So these stem cells can be taken out directly from the person by doing a marrow test and a direct expiration from the marrow, as well as filtering these stem cells from the blood. And these stem cells can then be given into the patient. Besides the established use of stem cells in the treatment of blood-related cancers, so people are actually looking for new usage of stem cells this day. One of the important areas is in regenerative medicine. So stem cells are used to repair damaged organs in the body. So organs like the heart, the joint, and the brain. Stem cells can be harvested from within the person himself or the patient himself, or can be sourced from a different person. So if for stem cells which are sourced from the same person who is the patient as well, so we call it an autologous transplant. So if these stem cells are given to another person for medical treatment, so we will call this procedure an allogeneic transplant. The difference between stem cell donation and organ donation, such as liver and kidney, for a person who decides to become a stem cell donor, he or she can live a normal life after the donation. For us, it is more complicated for the other organ donation, for example, liver or kidneys. It is much easier to donate stem cells than to donate an organ. So for a person who wants to donate stem cells, there is no surgery involved. What you need to do is to have a stem cell stimulant which wakes up the stem cells from the marrow into the blood. Then the person is then subjected to a pheresis procedure where the stem cell is being filtrated from the blood and the rest of the cells are being returned. Whereas for organ donation, the person has to undergo surgery and he or she will experience loss of part of the organ. And after a stem cell donation, the person can live a normal life throughout his life.